Hi, Assalamu alaikum. My name is Dilara Kaplan. I'm a research assistant at Karabük University, Turkey. Today, I'm going to present the topic malnutrition in children in the COVID-19 pandemic. I'll mention the COVID-19 pandemic, its process and results, effects of the pandemic around the world, malnutrition in children, and the impact of COVID-19 on malnutrition in children. The pandemic caused by the new coronavirus was first identified in Wuhan, China, in December 2019, and the World Health Organization declared the outbreak of COVID-19 as a pandemic in March 2020. As of 24th of October, over 243 million confirmed cases and over 4.9 million deaths had been reported. Various measures have been taken to prevent the spread around the world. Besides that, social distancing and isolation are at the top. The COVID-19 pandemic has caused not only a social but also an economic recession all over the world. Global estimates from middle 2020 suggested that economic contractions and food supply chain disruptions had led to 95 million people falling into extreme poverty and had contributed to increased household food insecurity. And since then, the economic growth forecasts have worsened. The pandemic and pandemic response have resulted in millions of people losing their sources of income. Households have changed to less expensive sources of calories, including non-perishable ultra-processed foods, starchy staples, cereals, oils, and also they had to reduce the consumption of nutrient-rich fruit and vegetables and animal-sourced foods such as fish, dairy, meat. And these shifts lead to poorer quality diets, which can increase the risks of undernutrition. The association between undernutrition and reduced immune function is well known, and more children are becoming malnourished due to the deterioration quality of their diets. Children, the interruptions in nutrition and other essential services affected children, especially in low-income and middle-income countries. Undernutrition during pregnancy and early childhood is known to damage the immune response. Children with inadequate nutritional intake have lower immune systems and are more prone to diseases and malnutrition. As in other infectious diseases, when the nutritional status is poor, the possibility of protection from COVID-19 infection and its complications decreases. So we can say that the COVID-19 pandemic is a public health crisis that has exacerbated worldwide malnutrition and related conditions. When it comes to pediatric malnutrition, it's defined as an imbalance in nutrition requirements and intake, resulting in negative growth, neurocognitive and body functions, and other clinical outcomes. Malnutrition covers two broad groups of conditions. One is undernutrition and the other is overweight, obesity, and diet-related non-communicable diseases such as heart disease, stroke, cancer, and diabetes. The data we see released by WHO in 2019, World Health Organization in 2019, and according to them, 144 million children under 5 suffer from stunting, and 47 million children under 5 were vested. And also, I didn't add it here, but 14.3 million of them, of this vested part, were severely vested. There's also an emerging phase of malnutrition, childhood overweight, and obesity. There were 38 million overweight children globally, and an increase of 8 million since 2000. The nutritional impacts of the COVID-19 crisis could have massive long-term productivity consequences that could extend to the future generations. Poor nutrition during early life stunts both physical and cognitive development, affects schooling performance and adult productivity, increases the risks of overweight, obesity, and diet-related non-communicable diseases later in life, and triggers the intergenerational transmission of malnutrition. So, in conclusion, COVID-19 has negatively affected the lives of many children, and measures such as developing new policies, including food aid, providing school menus to students free of charge, and performing health screenings in schools should and are expected to be implemented by the administrators as a state policy. Multi-sectoral action should mitigate waste increases by strengthening and expanding social safety nets and supporting local food and agricultural systems. Thank you for your time.